Broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome. My name is Julie Bates. Thank you for joining our webinar about the Fresh Start campaign, which was developed to help Alaskans find and use free programs for better health. This presentation is a part of a series of webinars provided by the Alaska Division of Public Health section of Chronic Disease Prevention and Health Promotion. This webinar series was created to provide a way for us to talk about our projects and explore ways that we can work together. Next slide, please. Before we start, there are a few housekeeping items to go over. If you're listening by phone, please keep it on mute. Please do not put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes. It will be a 20-minute presentation followed by 10 minutes of questions and answers. A recording of today's webinar will be sent to all participants, and the slides will be made available online soon, probably in the next week. Next slide. Audio for this webinar will come through your computer or telephone. Please hold questions until the end of the presentation, unless you have a technical difficulty hearing or seeing the webinar. To ask any type of question, you can type it into questions on the control panel. We can also unmute you and you can ask your question using either the microphone on your computer or with your phone if you called into the webinar. Just raise your hand by clicking the hand button. Thank you again for joining us. Now I'll turn it over to Ann Potempa and Andrea Finati.
Thank you, Julia. My name's Ann Potempa. I'm a public health communication specialist with the Alaska Division of Public Health, section of Chronic Disease Prevention and Health Promotion. And I'm here today to talk about our health department's new campaign called Fresh Start, Free Programs for Better Health. I'm going to be co-presenting today with Andrea Finati.
Good afternoon, everybody. Andrea Finati. I'm the Deputy Section Chief for Chronic Disease Prevention and Health Promotion, and I'm happy to talk about this campaign.
Thanks, Andrea. We built this campaign and launched it in December of 2022 to help connect Alaska adults with programs that they could do at any time in their lives to feel better, anytime they wanted a fresh start. We worked across our entire section to build this campaign, which means we worked with our physical activity and nutrition program, our tobacco prevention program, our programs focused on heart disease, stroke, and diabetes prevention, and cancer prevention. Andrea and I are really presenting together today intentionally because a big part of this campaign is incorporating data analysis, both public health data analysis and communication data analysis with storytelling. And so we're going to start with a story. I'm going to turn my camera off so we can focus on the slides, and when we're done, I'll turn my camera back on for questions. Christina of Anchorage got a wake-up call from her doctor about a year ago. She had gone in for some blood tests and found out her blood sugar levels were higher than they had ever been. A nutrition specialist recommended she join a program to better manage diabetes. Christina needed a special program, though. She is a shift worker at Red Dog Mine, which means she lives in Anchorage, but every week she's traveling to and from Red Dog Mine. So she needed to be able to do a health improvement program that was available on the go. She joined one of Alaska's Fresh Start programs online to lose weight and manage diabetes. The program Christina joined is not new. The Alaska Department of Health has been providing free programs to prevent and manage chronic diseases for years, and they work. We knew that many more Alaskans could benefit if they knew about these programs and could find them. Before, all of these programs were discussed on different websites throughout the Alaska Department of Health web system. And what we did is we organized them all in one place at freshstart.alaska.gov. And we built an entire campaign to send people there. Today, we're going to talk about why the campaign was needed, how it was developed, what it looks like, and is it working? And Andrea is going to start with why it was needed.
Thanks, Ann. So first of all, why did we think a campaign such as Fresh Start was needed? Next slide, thanks. Well, of course, we know that chronic conditions such as diabetes, heart disease, obesity are expensive to live with, manage, and treat, can reduce the quality of our lives, and also shorten our lives. And this is especially concerning because chronic conditions and the behaviors associated with them are so incredibly common. 2 out of 3 Alaska adults live with at least one of these chronic conditions or the related behavior like smoking. Now, most of us know what to do to reduce the risk of chronic disease. Eat well, be active, avoid tobacco use, get those screenings. However, studies tell us that only a small fraction of the adult population is taking all these actions. For example, one study in Alaska showed that only 15% of adults were doing all of the following: avoiding smoking, limiting sugary drinks, being active, and maintaining a healthy weight. And while programs exist that are proven effective at helping adults improve their health, and in fact, the Alaska Department of Health supports many of these programs, Alaskans by and large are not taking advantage of them. So having identified this gap, we set about collecting some additional data that might inform a public education campaign in a way that might in part address the gap between people wanting to take action to improve their health and actually taking those steps, including by enrolling in the effective programs that we already have. In June 2021, we used an online survey of over 2,000 adult Alaskans to explore inequities or unjust differences in the beliefs we hold about our own health, beliefs that are known to be linked to our ability to take the kinds of actions that will improve our health. What we found was there are pervasive inequities in health beliefs related to education and poverty. Those with low levels of education and those in poverty had more fatalistic views and less confidence in their ability to take the steps needed to improve their health, and actually were also less likely to be taking those steps. So this led us to identify adults of lower socioeconomic status as being a priority for this campaign. Now, because different regions of the state have higher rates of poverty and also may have less access to in-person prevention programs, we also identified certain regions of the state as being high priority for this campaign. It turns out that these same regions, the northern and southwestern regions, experience some of the highest rates of chronic conditions and so may especially benefit from such a campaign.
Thank you, Andrea. I'm going to talk about how we used the social marketing process to build a Fresh Start campaign. This is the same process that our section has used for years with the Tobacco Prevention Communication Campaign. And for our Play Everyday campaign that is 10 years old this year, that helps Alaska children grow up at a healthy weight. The social marketing process has you starting by establishing the problem and setting campaign goals, which for us is increasing knowledge of these free health improvement programs and use of these programs, and then ultimately over time, improving health outcomes. Then we prioritize an audience, which Andrea just talked about. We want to be sure we're reaching Alaska adults that can benefit from free, flexible programs like this. Then we better understand that audience through research. Andrea talked about a survey. We also did 2 rounds of focus groups in 2022, first to better understand what our audience knew and didn't know about these health improvement programs and what would be motivating to them about these programs. We learned that it was really motivating that these programs were free, no insurance was needed, and that they were convenient and you could do them your way. These programs improved quality of life and helped Alaskans live longer, and many of them talked about the value of adding short amounts of daily activity. We took this information and made messages out of them, and then went out and did another set of focus groups to test these messages to make sure we were making messages that reached our audience and was motivating to our audience to learn about and join these programs. What you're hearing is that we're using data throughout this entire process. We used it to inform our messages. We used it to understand the health problem. We use data to reach the right audience, and we'll use data to evaluate if the campaign is effective. Andrea is going to talk now about how we used data to reach the right audience.
So once the PSAs and other materials were developed, we wanted to be sure that our identified audience, that is adults of low socioeconomic status and those in the northern and southwestern regions of the state, would be most likely to see and hear them. So to help with this, we used poverty data from the census to identify those zip codes with the highest percentage of people living in poverty. This graph shows the census areas and boroughs of Alaska with the highest population totals of zip codes where at least 10% of the residents were living in poverty. So we ended up planning to deliver our campaign messages to, again, those in the northern and southwestern public health regions overall, and then in the remaining parts of the state, just those zip codes where we had a high percentage of the population in poverty.
Now I'm going to talk about what this campaign looks like. We launched Fresh Start in December 2022, and we did that very intentionally to tie into what's called the Fresh Start effect. That's an effect that says that there are times in our lives that increases our focus on making changes. And New Year's is definitely one of those times. It's when we're thinking about making a fresh start in some way. And any Alaskans who are setting a New Year's resolution to feel better in some way could find a free Fresh Start program to help meet many of their health goals: losing weight, lowering blood sugar, lowering blood pressure, or stopping smoking, vaping, or chewing. We have grouped our Fresh Start programs into 5 key categories. One is lose weight or prevent diabetes, lower blood sugar to manage diabetes, lower blood pressure, again, stop smoking, vaping, or chewing tobacco, and being active with your children through a program that we support called the Healthy Futures Challenge. Then each of these programs have key components that were really motivating to our audience when we talk to them in focus groups. You do these programs your way. Many of them can be done online or by phone, and some communities throughout the state offer in-person versions of them. You get support from coaches and in some cases, health specialists to prevent and manage diabetes and high blood pressure. So you don't have to do these programs alone. All of these programs are free and you don't need health insurance to participate. And you can do these programs anywhere at any time at your own pace. And that was really attractive to many people who heard about the Fresh Start programs. So what we did is we took these programs and then we took the motivating parts of those programs and we made a series of messages about the Fresh Start programs to share with our Alaska audience statewide. And we used many different communication channels to reach them so that we could find these Alaskans and reach them no matter where they were listening or reading or watching. And so we put all of our programs in one website again, freshstart.alaska.gov. I'll show you that in a minute. We also created 30-second video and radio public service announcements that we are sharing statewide. And we're doing special runs of these in our northern and southwest regions as well. We are running messages on websites that Alaskans commonly visit. We are running social media posts on Facebook and Instagram through our Alaska Department of Health. We're publishing blogs so that we can write about the campaign as a whole and individual programs in a more detailed way to better explain them. We printed messages that are running right now inside buses in Anchorage and Fairbanks. We have new posters and handouts that healthcare providers, health fairs, and others can hand out. And we worked with media outlets like newspapers and newscasts to publish articles and stories about Fresh Start. We don't have time during today's short webinar to show all of our public service announcements, so I have put our YouTube links in here so that you can watch them at a future time. And we will be sharing the slide deck with you so that you can find these links and watch them. But we have several messages. This one talks about the programs and the key motivators of these programs in just 30 seconds. This is our Fresh Start website. Again, freshstart.alaska.gov. And you can see right away that it is written with very few words and very simple words. We worked very hard to write this at about a 6th grade reading level. And we organized all of our programs onto simple colored buttons. And when you scroll down the website, you see that these buttons get larger. And it really helps you easily find the health goal that you want to achieve. And then right away, you can see you have 2 quick options. If you want to read more, you can click on the Read More button. Or if you're pretty sure this is something you want to do, you can click right away to Are You Eligible? And then fill out an eligibility form to see if this program is a good fit for you. So right now, one of our most popular pages on the Fresh Start website is this page about losing weight or preventing diabetes. So let's say you want to read more and you click that button. What happens is you get a new web page that opens up and you're able to see that you can take this program in 2 different ways, online or by phone. It's your choice. And what you'll see is that you'll have kind of the same benefits in each program. They run for about 12 months, so you get sustained support. You're matched with a coach, and you get free tools like a free bathroom scale to help monitor weight. So you'll see that you can do this program online, you can do it by phone, and then if you're down to the point where you pick the program that you want to do, you just click here to check if you're eligible, and then you will get sent to the eligibility forms to fill out. Very simple. I'm going to walk through the individual programs, but many of them have these same motivating factors. They working with a coach, being free. So I'm just going to spend a little bit of time on each slide focusing on the unique factors for some of these programs. So this program to lose weight or prevent diabetes is unique because this does have 2 different ways to do it, online or by phone, free either way. This is another public service announcement. So if you have time, Alan in North Pole completed the phone-based program to lose weight and prevent diabetes and had great success. He worked with a coach in Homer during his year and was able to lose almost 60 pounds and return his blood sugar to healthy levels. Our program to lower blood sugar and manage diabetes is offered online. And in addition to a coach, you're also matched with a diabetes specialist to offer help throughout the year. And in this program, you're given free blood sugar monitors along with short lessons. Similarly, our program to manage blood pressure is also offered online. You're matched with a blood pressure specialist, in this case, along with a coach, and you receive a free blood pressure cuff. The Fresh Start free program to stop smoking, chewing tobacco, or vaping connects Alaskans with the long-standing free Alaska's Tobacco Quit Line. And that quit line is great because you can work with coaches to create a personalized quit plan. If needed, you can receive free patches, lozenges, or gum to help stop smoking, vaping, or chewing. And you can call the quit line as many times as it takes to quit. Finally, the Fresh Start program to be active with your children connects you with the Healthy Futures Challenge, which is a program that we promote both through Fresh Start and our Play Every Day campaign. It actually kicks off tomorrow, February 1st, in almost 90 elementary schools across the state. Kids who participate log their activity through their participating elementary schools and can win prizes. But what's great about this challenge is that parents and siblings and grandparents can do the physical activity challenge with their kids and be active as a family. Many of our Fresh Start programs build in activity as a way to feel better now and for years to come. They talk about the benefit of short amount of activity and that over time, daily activity can prevent and manage chronic diseases. This is our last public service announcement. Again, the YouTube link is at the bottom, so you can watch it at another time, but it talks about the benefits of 10 minutes of physical activity every day. That's, again, for more immediate benefits like lowering stress or sleeping better that night, to longer-term benefits of losing weight, maintaining a healthy weight, preventing chronic diseases, managing chronic diseases, and actually having a better chance of living a longer life. We write about the Fresh Start campaign in blogs. The blog website is at the bottom. When you go to this website, you can find a subscribe button. And if you enter your email address or your text message, or your text phone line, you can get a quick message anytime we publish a blog so that you don't have to know when we do this. We can send that out to you. And we'll put that address in the chat field so that you can find it. We also have print and video materials for free download on our materials website, which again is at the bottom. We have a poster, a two-sided handout, and a small business card size handout that gives brief information about each of these programs, the benefits of using these programs, and how to find out more. At any time, you can email the DOH at .freshstart@alaska.gov and ask for those materials to be mailed to you for free, or you can download these from the website. It's very important for campaigns like this to focus on evaluation. Are we reaching the audience? Is it resonating? And is it making a difference? And Andrea is going to talk about that.
Thanks, Dan. So any campaign is really only as good as its evaluation. How do we know that we're having an impact? Our team has worked to put in place a solid plan for doing this. First, we worked with our media contractor to map out specifically how much of each of the media elements, so the videos, the digital ads, et cetera, how much of them are aired and where. And this plan was guided by the zip code analysis I mentioned earlier. We will monitor media placement over time to get a measure of the extent to which Alaskans in different parts of the state are exposed to the messages within the campaign. We will look at web analytics to see how much traffic the Fresh Start webpage gets. And results so far are kind of impressive, showing that the Fresh Start page is getting a significant amount of traffic. You can see a few of the stats here, over 22,000 views in the first 3 weeks of the campaign and almost 12,000 readers of its first blog. We also will be conducting what's called a recall and reaction survey after the campaign has been running for several months. One of the important pieces of information we'll get from the survey is how aware Alaska adults are of the campaign. From this survey, we also will get information on whether adults recall any of the specific ads that we run. Finally, the survey will also give us information on whether those who saw or heard the ads did any of the things that we hope they might do, like share the information with a friend or loved one, visit the website, or even sign up for one of the programs. And because we're doing an online survey format, we can provide links to the ads themselves. We can find out even if those who have not seen the ads before but are now seeing them for the very first time as they take our survey, think they will be likely to take any of these actions in the future. We are also working with the providers of the programs so that we can track the number of Alaska adults who apply to, enroll in, and complete each program. This graph shows a dramatic increase in applications to the online programs following the launch of the Fresh Start campaign, noted with a vertical orange line. In just one program, the online program to help Alaskans lose weight, and this has been running prior to the Fresh Start launch, hundreds of Alaskans have lost over 4,600 pounds in the last few years. And I'll point out that we've found out that the target that we set for this campaign, which was a 20% increase in enrollments from January to June, here we are the last day of January, we've already met and exceeded that target.
So Christina's story continued. Christina spent the last year participating in the online Fresh Start programs to lose weight, lower her blood sugar, and lower blood pressure. And during that year, she lost 50 pounds and returned her blood sugar and blood pressure to healthy levels. She felt so good, she encouraged her husband, Pete, to join. She told him she really wanted him and her to get healthy so that they would have more years together. Over the year, he lost 60 pounds and also lowered his blood sugar. Nearing the end of the program, Christina said, "Why didn't I do this sooner?" Thank you very much for joining our webinar today. This is our contact information is on the screen. Again, Ann Potempa and Andrea Fernati, we both work with the Division of Public Health on the Fresh Start campaign. You can find our website at freshstart.alaska.gov. Our social media channels are all at the bottom. Please check those out and share those. And again, at any time, feel free to email me at this email address or doh.freshstart.alaska.gov to receive any of our materials. They're all available for free. And please do share these programs with family members, friends, and with people that you serve through your work so that more Alaskans know about them and benefit. Thank you. And we're both available for any questions.
Thank you so much, Ann. I don't see any questions in the, somebody just says thank you for the information. If anybody has any questions, please put them into the question box or let me know by raising your hand and I can unmute you.
And while we're waiting for questions, just a reminder, we will be sending this presentation out to everybody who registered, even if you couldn't participate in the whole webinar today, we'll send those out as an email so that you can get these links that I'm talking about, and all of our email addresses and all the information will be there. So you'll get another copy of that.
All right, we have a couple of questions that have come in. Excuse me. Do you have any resources specific to children, teens, or expecting parents?
Right now, the main program that has a connection to children would be our Be Active with Children program, which is our Healthy Futures Challenge. That one primarily right now is geared toward families with children in elementary grades, K through 6. The rest of the programs are primarily geared towards adults. How well do these programs work for those without a computer? We are trying to be able to provide our programs in several different modes. So we have computer-based programs. We also have phone-based programs, and then in a number of communities, in-person programs. So throughout the campaign, we're trying to make sure that we have an option that works for those who need it. And I will say that email address, doh.freshstart@alaska.gov, we are fielding questions from people when they're trying to enroll and having questions. So that's a great way for us to interact with Alaskans to help guide them toward the programs that might work best for them.
There's a couple more questions. Next is, are these only available to those in the lower income bracket or open to anyone?
These programs are open to anyone. They're free programs, again, no insurance needed. So yeah, when you go fill out the form, it is open to anybody who does meet the eligibility requirements. When you fill out these application forms, these are often distance-based programs. And so the best fit will be an Alaskan who could benefit from these programs, but also could benefit from a distance-based program. And so that will come out in the eligibility form. And can we talk about the eligibility requirement criteria for the programs? That's actually not an easy question because all of these programs have their own eligibility form to fill out. So it will vary program to program. I'm not seeing any other questions unless you are, Andrea, or...
I don't see any others. And I don't see any hands raised. Yeah, well, thank you so much for the information. We really appreciate it. You can always contact Ann or Andrea. I put their contact information in the chat box. And then the slide deck will be available to everybody. But please reach out if you have any other questions.
Thank you so much for your time.
Thank you.